All right, so thank you for having us today. I'm here with my deputy, Lisa Crossman, to go over some updates on COVID that we have for you. So I always get accused of bad news, and so we do have some good news as of late. And so coming off of the holidays, it seems like we have finally started to come down off of that. And so remember, we were more than double these rates just a few weeks ago. And so we have 473 cases of the COVID by PCR per 100,000. And so that is extremely great news. When you look on the right side, you can see the graphic. So it's showing that we are seeing a decline. And so we're doing well in that respect. Now, deaths are a little bit lagging, and so the total deaths, you can see here that these are the PCR deaths. I'm going to show you a little bit later the total number of deaths that include the antigen deaths, which is what hospitals have been doing a lot of recently, and so we have to include those as well. You can see the spike in number of deaths that we've had and the prolonged surge that we had this time due to the multiple holidays that kind of compounded on top of each other. When we look at our cases, so we have our PCR cases and the antigen cases. You see that the antigen cases do make up almost a quarter of the number of cases, and those do get included. When we look at the confirmed and probable number, we're at 786 deaths in the county that are confirmed and probable. So those are from the antigens and PCR. So you can see that it does add quite a number of deaths when we look at it that way. The number of admissions in the hospitals are decreasing, and that is one of the things that I really love to see, because that means that they have some more room to take care of everybody and anybody who needs to come in. And so they are breathing a little easier right now, and it seems to improve every day. And so they still have high numbers compared to when we had our lower numbers of cases. But you can see how the number of cases, the case rate kind of goes hand in hand with the hospitalizations as well.
Dr. Memark, can you clarify PCR and antigen?
Yeah, so the PCR is that the test that we're doing in our drive-through settings, which is one that looks for the genetic material in the specimens. The antigen is the response that is being seen, your immune response to the virus. So it catches the time that you're most infectious. And so the antigens get accused often of having more false negative rates. But when it's a positive, it is really considered to be a true positive at that point. But it can miss some negatives, though. And so, and it's what's nice about the antigen is it's quick. You can do that in 15, 30 minutes and get a result. And you can see why that's so popular now. People want to get those results quickly, but they get reported the same way if they're positive. When we look at our aggregated deaths, and this is with our PCR and our antigens together, you can see we had talked, Chairwoman, on yesterday at the Wellstar meeting that January was a particularly deadly month for us with COVID. And you can see now how it, when you add in those the antigen-related deaths as well, that definitely it was our deadliest month. February is slowing down a bit, so we're very grateful for that. But definitely was a lot. Here are the deaths that we've had, and so you can definitely see how it is still in our older folks, and I took a look at it, and it continues to be in our older populations. I know there's a lot of controversy over the vaccine and the tiers and priorities, but you can see how many people that we have lost that just from the 60 and above all the way through 98. It's a tremendous number of deaths, and so we continue to monitor and try to protect this population as best we can. Here are the phases, and continues to be a very large phase that we're in right now, and so I don't have to remind you of the 1A plus group. Here are the vaccines. I know a lot of people are interested in that, and so far we've given over 17,000, almost 18,000 vaccines, and Cobb County alone has done close to 16,000 vaccines over at Miller Park. Yesterday, they were able to do 668 vaccines. This is definitely not anywhere near the capacity that we can do, but because of the vaccine supply, we are really limited to second doses. So we have not been able to open the schedule for a while. We've received a little tiny bit of extra vaccine that we're talking to the senior center about going ahead and trying to do an outreach event so that we reach some very vulnerable folks. So we don't have enough to really open up the portal. So we wanted to just reach the most vulnerable people that we can. We continue to work with our community partners on that mass vaccination. So obviously we don't have enough vaccine now, but we have some very interested partners that are prepared to do a large site when we are ready to do that. So we're going kind of through the fact sharing and preparation process at this time to get something like that going. And this is mostly for when we have enough vaccine and the priorities get opened up so that we can vaccinate as many people as quickly as possible. And that really is the goal for our vaccine efforts. Well, right now we're hearing word that still vaccine supplies are not thought to be increasing until about March or April. The state is receiving 154,000 vaccines per week for the entire state of Georgia. And so there is a federal program that is starting that's going to send some vaccines directly to some of the chain pharmacies. We don't know the scope or of that or details of that procedure. So we'll hear more as it comes out. Johnson & Johnson this week has applied for emergency use authorization of their vaccine. That is scheduled for February 26th. So if it goes the way that Moderna and Pfizer went, we anticipate that within a couple of days, if they are approved, that vaccines will be shipped and on their way. I want to talk a little bit about the Johnson & Johnson vaccine so people will know. It is a one-dose vaccine, which is very, very nice for ease of use. And so with all these issues with kind of scheduling and uploading into the state system, it makes it a little bit easier. This one is a DNA vaccine that produces that mRNA protein spike, not proteus, I apologize, protein spike. And so, it produces spike protein, sorry. So just to give you an idea, the Pfizer and the Moderna vaccines are mRNA vaccines that produce that spike protein. And so this one backs up a little bit and does it through the DNA. And so it's a little bit different, but the outcomes are supposed to be very similar. The safety profile is very similar, and they did not have any anaphylaxis in the group that they reported. It is considered 72% effective in the United States, at 28 days, it had remarkable outcomes, so no deaths or hospitalizations, and so that include anybody on a ventilator or using that extracorporeal membrane oxygenation, which is a really critical procedure. And so the results of this are very good, so they're showing that it has some very good efficacy. I want everybody to remember it does have, it was done at a different time from the Moderna and the Pfizer vaccines. And so when this trial happened, it was really during a very, very high rates of COVID throughout the country. It was done in multiple countries together. And so, but the results in the United States showed a 72% effectiveness, which is still very good. And then those 28-day outcomes are excellent. If no one has any questions on that, I'll move on to the variant, which is something that is on my mind a lot. The UK variant has been identified in the state, and it's over 30 states in the United States at this time and multiple countries. Cobb and Douglas County does have multiple cases of the BK117 variant. It's thought to be about 50% more contagious and possibly more deadly than the variant that we have, or the strain that we have right now. Doubling time in the U.S. is thought to be every 10 days, and so we have seen it in the United States, and it definitely is following this path. The vaccines do seem to be effective against this one, so all the more important to get out as many as we can as soon as they come out to us. So takeaways on this, we have some more vaccines on the horizon over the next few months. We continue to be concerned about the variant strains, and we have some great news that our cases are coming down as well as our hospitalizations. But I don't want people to get complacent about this because it definitely, we need to keep the variant strain at bay. And we got to do that by the same things that we've been doing, so wearing the mask and physically distancing and washing our hands and really trying our best not to gather outside of our households too much. And if you do it safely. Is what we definitely recommend. I want to thank everybody, including definitely Cobb County, for helping us with all of these efforts. I know we're working on more efforts including trying to get a call center set up soon so that our residents have somewhere to call and make appointments as we get more vaccines coming our way. So, but thank you for everything, and I'm happy to take questions.
Thank you, Dr. Memark. Do any of the commissioners have questions this morning? Any commissioners have any questions? We have no questions this morning, but certainly want to thank you and Lisa for continuing to provide these updates, not only for us, but for the public. And also want to thank you again for your heroic efforts in keeping our populations safe and in providing the vaccine at Jim Miller Park. We were fortunate to have the governor last week, and I walked away from that, and I think he did too, feeling really good about your efforts. You made Cobb County shine that day, and I know, again, this is a tough time for a lot of people, but from all the feedback and from what we've seen, once they get to the vaccination site, they have been quite pleased with the level of service that was provided. So we thank you. We know this is an issue of supply, and hope that once we can increase that supply, that we can continue to get more people through that operation.